Time for another health care reform update. Parts of the new law went into effect earlier this month. Other parts being phased in as we speak. Our insurance expert, Craig Gussin, here this morning to fill us in once again. All right, the parts of the new reform law that went into effect earlier this month, what are those?
Well, the biggest one, I think, is going to be the high-risk pool. It's supposed to go into effect this month. Now they're taking applications. It won't go into effect, they're saying now, until sometime in August because it isn't up and running. But you can at least apply and get online.
So these are people that previously couldn't get insurance or had to pay exorbitant amounts because they were in a high-risk group. So now there'll be insurance for them?
Only for people who have not had insurance in 6 months or longer.
Okay.
And they can come on the plan, and if had been denied other coverage in the past. They will be paying the standard rates that a normal person would pay, you and I would pay at the same age. The concern I have is they have $5 million put away to, pay for that. And what I'm hearing is it's going to run out of money in 2 years. Because they use it more than other people would. Okay. That's one. The other one is the one that we talked about, the tanning tax. They're going to have a 10% tax on people who tan, and that's really going to hit middle America.
Yeah, this thing, though, it just strikes people, I think, in a very odd way. Why put a tax on tanning beds and people that tan? I mean, it's kind of like the tobacco tax. It was supposed to go towards health care related costs for smoking. It didn't. All the money went into the general fund in states all across America. Same thing here, that we don't really believe that this money is going to go towards what melanoma research or anything health care related, do we?
No, it was supposed to be the Botox tax, and they had a big argument with the AMA, and they ended up making it the tanning tax. It's pretty ridiculous. There is a web portal now, though, you will be able to go to, so you can get information and start trying to figure out which plan is best for you. That's pretty much what's gone on up to now. Coming up in September is going to be where if you have a policy and it's got, like, say, a $5 million lifetime maximum, it's now going to be unlimited on your anniversary date of your policy. So if you bought health insurance for your family, let's say in January, next January, you would have an unlimited lifetime maximum.
So this really is important to people who suffer some kind of debilitating injury. Yes. or a very, very long-term illness, folks that might be confined to a wheelchair or to bed for the rest of their natural lives.
Exactly, okay. And that's... the best example I have is is Superman, Christopher Reeve.
Sure.
He's one of the few people that ever met that. From the insurance company's point of view, what I've heard from them is they've had like 2-3 claims in the last 20 years that have hit that. So it's not a real big deal.
So it doesn't affect that many people?
No.
Okay.
But then also the other thing is there's a lot of plans out there where they limit how much benefit you can get in a calendar year to, let's say, $100,000.
Right.
That also is going away, which is going to be a nice thing. It's always a concern I have. So the major risk plan that we have in California right now has it. It covers X amount of dollars, and that's it. So everything's going to be changing in a piecemeal effect between now and 2014. The other one that's going into effect this year is when we talked about with children. Once kids will be able to stay on their parents' plan until they're 26. However, you won't be able to add the kids if they're not on it today until the anniversary. So if right now where you work, if your anniversary is January 1st, you would not be able to add your kids back on until January.
Okay, so let's say you've got a 23-year-old that's off at college right now that is not on your insurance plan. You will be able to add them back onto your insurance, but not until the anniversary date of your policy.
Correct, of the group, either the group plan or your individual plan.
Okay. What do you see about this thing, how it's working so far? I mean, usually we get an update from you when you come in, just in terms of, is it effective? Is it making meaningful change?
It's, it's going slow. It's what you and I have talked about in the past. A lot of the things that they said we want to do within 3 to 6 months is just taking a lot more time. The big concern is, I've always had, is how are we going to pay for all this and what's going to happen? I think the elections are going to tell a lot, because one of the things I'm hearing is that they may not fund it if the Republicans take over the House and the Senate. The other thing is, I met with a congressman the other day. He doesn't think that mandates will get through the Supreme Court and would actually be allowed to have mandates. And if that happens, that's going to throw us into what New York, New Jersey, and Massachusetts has, which is the highest rates in the country. And for an example, a $1,000 deductible is $800 a month there. Here it's less than $200 a month.
So when you say mandates, you mean forcing people to buy insurance? You don't think that's going to clear the court challenge?
Meeting with a congressman, and he was telling us that he thinks that when it gets to the Supreme Court's going to say you can't force people to buy health insurance. And if that mandate passes and they keep health care reform like it is, that's going to make rates go skyrocket, especially in California.
The reason behind that would be because people that would have been mandated to buy insurance won't be paying into the pool now.
Right, exactly.
So their dollars will not be in the pool, so
right.
the money to pay for all the rest of this stuff has to come from somewhere.
What you're going to do is you're going to call me up on the way to the hospital and say, hey, I broke my leg, I need health insurance, and I cover you. You're going to say, how much is it? I'm going to say, oh, for you it's $800 a month, and you're going to pay for it for 2-3 months. You're going to come home, get all your rehabilitation, you're back to work 100%, and you're going to say, okay, I want to drop my insurance, I don't need it. And there's no skin in the game.
So right now, the way the plan is written,
right.
you could do that, conceivably.
We'll see what happens.
All right. Craig, it's always a pleasure to see you and come in here and give us the updates. Thank you so much. We'll see you next time around.
Okay.
Craig Gussin. All right, for more information, you go to san diego6.com. You click on Hot Topics.